Hello and welcome to Bobby Scott and Associates Professional Counseling here in South Haven, Mississippi. Today we are meeting with Marty Forsythe. Marty is a therapist here. And Marty, you and I have talked a lot about trauma and that being one of your major expertise areas and things that you like to focus on. Can you give us an idea of what you see when it comes to trauma and maybe help us understand what trauma is?
Well, I think you and I have talked before, that trauma sometimes can be so misunderstood that most of the time when I'm working with people, I more or less go back into their history and ask them, is there some things that maybe has been disturbing that's happened to you in the past that it still disturbs you today when you think about those kind of things? And that's kind of more the mode that I go on, and it could be things like when they was a child that they was abandoned, for maybe periods of a week or a day or two. It could just be a day or two. And then they don't look at that as trauma because obviously in a 25-year-old female, you wouldn't think, well, that's traumatic, and I dealt with it. But it can cause a lot of long-acting effects. It can affect the way you deal with things when you get to be older. And so that's important to deal with those things early in life. Sometimes that it's trauma, but I guess you would relate it to the trauma field, but in all, it's things that has been very disturbing and still is causing some effects today.
That makes a lot of sense. So a lot of the people then that you treat tend to have unresolved childhood trauma. Can you give us a quick picture of what that looks like?
Yes, and you're right. That's, a lot of times you think of trauma, you think of people that combat veterans, you think of police officers, you think of paramedics. That's the way, and I did too at one time. When I think of trauma, that's who I think about. Or maybe somebody that has been physically violated, sexually violated, but quite often it goes back, what it really looks like is just in childhood. Let's say, for an example, that if you're a child, let's say 5, 6 years old, and you have parents that are very dysfunctional, and then the dad comes in yelling and screaming to say he's been drinking, and he's throwing things around. He's not hurting the child at all. There's no physical abuse to the child. Let's say that the child sees the dad, maybe physically violating the mom, and then it's a very scary, type of event for that child. And quite often they will shut that down, maybe go to their room. And when you think about disturbances, that adult that you're sitting here doing therapy with, they say, I haven't seen anything. But then when you go back and ask them those type of things, they say, oh yeah. And that very well could have a traumatic effect upon them now. That's the reason that you have to go back and, and really delve into those type of things in order to try to resolve, like you just said a minute ago, some unresolved trauma.
Exactly. Wonderful. Okay. And so a lot of times people come in, they don't really understand exactly what has happened, but you help them to pinpoint where a lot of these disturbances originated and help them to begin to work through them so that they can function more effectively.
Sure. Yes, I do.
Wonderful. And so one of the techniques that you use is EMDR. Could you tell us just briefly what that looks like?
Briefly, EMDR reprocesses those disturbing events that has occurred in your past. And it does that through a technique that is similar, now not the same, but similar to REM sleep, rapid eye movement sleep. And the lady, Francine Sapiro, the one that developed this type of therapy, used that to basically what it does. Of course, during REM sleep, if you go through a REM sleep cycle, your eyes are moving back and forth real quickly. And when it does that, it turns on the left side or right side of your brain. Well, when I do the EMDR, the technique that I use that simulates that, I use paddles that vibrate left, right, left, right. I don't put you to sleep. So basically what you're doing is holding those paddles and they're vibrating left, like I said, left, right, and it will also turn on both sides of your brain. And what that does, since both sides of your brain is open, it allows the images and the original images and the sounds and the smells and all that kind of stuff is on one side of the brain to be able to connect to the other side of the brain, where we can try to cognitively process or reprocess that event that occurred in the past.
Oh, that's wonderful. So really, it's taking control of your past.
Yes.
Awesome. Wonderful. Well, thank you, Marty, for the information. And of course, we know that people can get in contact with you through Bobby Scott and Associates Professional Counseling.
Yeah, good.
Thank you.
Thanks. Good to talking to you.